walking, that nerve gets pulled, tugged, irritated, and it's got Velcro in between it and surrounding tissues. Pain. Hello everyone, this is Dr. Ryan House with Cumberland Chiropractic and Sports Medicine. This past weekend we had a really cool 5K race here in our town called Sherry's Run. It's a big deal. Thousands of people show up. It is a 5K benefit for cancer that they do every single year. With any foot race comes lots of training, pushing yourself to the limits, and then a lot of times some people experience foot pain as a result. So plantar fasciitis is what we're going to talk about. We're going to talk about the big three common, let's call them situations that happen that might cause bottom of the foot pain. We are going to hopefully make your foot problem, if you've got it, more digestible, treatable, maybe excite you a little bit about how it can be fixed. If this sounds like you or somebody you know, stick around. So plantar fasciitis. I don't typically like to use plantar fasciitis as kind of the end-all diagnosis that I give patients. I typically like to tell them exactly what portion of that foot is causing their pain instead of using that blanketed term. But typically what you mean is inflammation of this ligamentous band that runs across the bottom of the foot, this blue line here. Some things that are really important to know about the foot and how that band works with it. You can kind of imagine that this foot, the bones, are a lot like the limbs on a bow. You can see how that's curved like an arch. The band, those ligaments, are a lot like the string on the bow. You don't stretch the string on a bow. You actually stretch or bend the limbs on a bow in order to use that thing. So now let's put that into this pain situation for this foot. So let's say we've got a spur forming, we've got pain that extends along the bottom of the foot, feels like it's a dagger sticking into the heel. Most of the time, and this is our first situation, this bow and the limbs on it have gotten too stiff. So let's change this flexible into steel. Let's change it into a rod. So every time you go to step, you end up stepping on a string that is stretched as far as it can go. The solution in this situation, loosen up each joint. In these rays, we call them, you loosen that up, this becomes a shock absorber, this guy gets happy again. Second situation that will a lot of times be the culprit and the fix in these bottom of the foot pains. My buddy Sully here, he has pretty limited ankle movement. He's got a lot of movement in his foot, but very limited this way. Us, as people, we need a lot of movement in this joint right here, the mortise joint, okay? If your mortise joint doesn't move very well, especially if it moves asymmetrically, okay, or uneven, what'll happen is every single step you take, especially if this guy on the back of the mortise is stuck, you'll do bend, twist, and pull on this inside edge of your plantar fascia, aponeurosis they call it, every single step you take. If the opposite thing happens and every single time you step, you get this kind of a twisting and loading the outside, you end up tugging the outside of this band. So in the end, it's like all I've got to do is fix this straight on bending flexing or dorsiplantar flexion of the foot. All right, last but not least, and this one's probably about 50% of the time, it's that common that a nerve entrapment is happening. There is a big branch of sciatic, which turns into tibial, which turns into these plantar nerves, and very, very commonly in this little groove where it passes, that nerve gets stuck. Just the way you move, the way your foot functions causes wear and tear. Wear and tear equals inflammation. Inflammation tends to scar. Scar grabs tissue. If that nerve has been grabbed and it's stuck, every single step you take, especially after you've been off it for a while and you start back up standing and walking, that nerve gets pulled, tugged, irritated, and it's got Velcro in between it and surrounding tissues. Pain. This list of 3 situations that cause the foot pain, it's not all inclusive, but probably this gets somewhere in the 85% range. Everybody's unique and they could have a different problem other places. We're picky. We'll find it for you. I want to talk about two strategies that people typically use, both home stretches, especially calf stretches, and then orthotics. I like both strategies. The stretching your calf, stretching your Achilles tendon, that might give your ankle some room, take a little pressure off the plantar aponeurosis, maybe relieve a little bit of that pain. Orthotics, they will typically help that foot that I said likes to twist and put asymmetrical load, or twist and put, the orthotic typically will help with aligning that motion of your foot. So good things. The problem is, I just don't think it fixes it all the way. What you need is somebody to get in there and go all in at what your specific unique problem is, and that's what we do. If you like this video, I want you to please give it the thumb up. Okay, it means a lot to us. If you think this video is worth it, share it on your timeline. Share it with a friend that you know is struggling. If you've got a question, something about your foot, something that you think was confusing about what we said, please leave it below. This has been Dr. Ryan House with Cumberland Chiropractic and Sports Medicine, where we get your foot better faster.